So for so the diagnostic assessments for autism, ADHD, learning disorders, developmental delays, all of that sort of thing. So we'll talk a little bit about that and kind of what that process looks like at Eyas Landing and kind of how it can help kids and families just to access resources and kind of understand kids' needs and that sort of thing.
Great, thanks, Shay. I realized I stopped the recording at the very beginning because we were messing around with certain things, and so I wanted to make sure that the recording was on for anyone who needed it. So just as a reintroduction, my name's Kelly, and I'm the Assistant Clinic Director, and as well as a speech-language pathologist. So we're going to talk a little bit about Eyas and who we are. So Eyas Landing is an outpatient pediatric clinic. We're located in the West Loop, and our mission is to deliver the highest quality and holistic and relationship-based care to individuals and their families across environments to reach their fullest potential. So the children that we service and their families, they vary in diagnoses as well as age. We have children that we're seeing anywhere from birth, up to the age of 22 years. For the most part, there are diagnoses of autism as well as sensory processing disorder, attention deficit hyperactivity disorder, anxiety and depression, speech and language delays, motor delays. And then the services that we provide. So we provide a wide range of services. We'll talk a little bit about those later, but primarily we have occupational therapy, speech language pathology or speech therapy, physical therapy, social work, applied behavior analysis, neuropsychological evaluations, as well as early intervention and feeding therapy. We also have our therapeutic tutoring and educational supports, and we provide these services in the home, community, school, and clinic settings. We do provide services as well virtual within the state of Illinois. Before we dive into what we do in terms of neuropsych evaluations and what makes up our therapy team, does anyone have any initial questions for us? You can either write them within the chat or feel free to unmute yourself or show yourself on the camera.
Kelly, I was wondering, what's the difference between a medical evaluation or medical diagnostic and a neuropsych evaluation?
Dr. Shay?
Great question. We get that one a lot. And the truth is not a whole lot. The medical diagnostic testing is usually done by a medical doctor, so an MD, whereas the neuropsych testing is done by someone like me, a PsyD or a PhD. So kind of that difference in training is the biggest difference. So medical doctors are trained in like medical assessments. So they might include kind of more, a typical physical. They might take labs, things like that, and kind of discuss things like medications or other therapies and all of that sort of thing. With neuropsychological testing, our training is mostly in behavioral health, emotional health, mental health, and that sort of thing. So a lot of especially for kind of younger kids, 0 to 5, a lot of that assessment looks similar. So looking at developmental levels, are they meeting their developmental goals? Adaptive skills, doing like an ADOS or kind of parent forms. With the neuropsych testing, sometimes we like to get a little bit more granular. So we'll dive into some of those skills a little bit more to, for example, look at things like visual spatial development. How is that kind of fine motor development, language skills, communication, and kind of the role of emotional health. What's the role of anxiety in a child's presentation? And we get a little bit more systems training. So a little bit more kind of looking at that family dynamic and helping the family to understand, what's the best way to be attuned to this kid that can kind of help them kind of move forward. So in terms of the assessments that we do and the diagnosis that we look at, that's really similar, but really kind of that scope of training is the biggest difference. Does that make sense? Does that answer your question?
Yes, thank you.
All right, thanks. I think we have a blog post that we're going to be putting out about that for that specific one because we get it so often.
And it leads us into our next topic. So go right ahead, Shay, take it away.
All right, love it. So like I said, we just started doing neuropsych testing at Eyas Landing just about a year ago, just to really kind of bridge that gap to help our kids access services a little bit easier, to help their treatment teams, families, and schools kind of understand kids' needs a little bit better. So just kind of a broad overview of kind of what we look at in terms of testing. Like I said, we look diagnostically, so at things like autism, ADHD, learning disorders, things like that. We also want to really get a really good understanding of, anxiety, depression, kind of social skills, and what does their social circle and social opportunities look like? What are the behaviors like at home? And kind of how can we help support them? One of the things that we like to do is at Eyas Landing, especially for our kids that are here, is to reach out to their teams as much as possible. And for our other kids, reach out to family members, teachers, things like that. So in terms of kind of what that process looks like, we always start it with just kind of doing the first intake appointment. The intake appointment, you would be meeting with me. So I meet with the parents, sometimes the kid, if that's available. COVID has kind of messed with our processes a little bit. I used to do all of my intakes in person to get to meet the family and the kid all together, to kind of build some rapport and really get to know the situation, and kind of what the concerns are with everybody in the same room together. With COVID, we switched to doing more virtual intake sessions where typically I get to meet with the parents, or the caregivers. And if the kid's available, I like to always kind of say hi and get to meet them a little bit as well. But really in that intake appointment, what we're doing is I'm going to try to get a good just background information from you guys about what's going on, what the concerns are. So get kind of not only a developmental history, an idea of kind of current concerns and current worries about, what kind of brought you into testing, and developmentally, what are the struggles that this kid is having, whether that's with their language development, with their attention, with behavioral concerns and that sort of thing. Kelly, did you just pop up your screen? Can you go back a slide? But yeah, behavioral concerns, that sort of thing. So as we get all of that good background information, one of the things that I really like to talk to families about is to help them form some questions that they would like to have answered during the testing process. Those questions can be anything from like, what's the role of anxiety in the struggles that the kids are having? Do they need occupational therapy? What's the role of like sensory struggles that they're having? Like, how much is the sensory processing impacting their behavior? What else can we do at home to make structure a little bit easier? Anything like that can make the assessment process more useful and more helpful. I like to think of it as not just, okay, let's go get a diagnosis, but let's really help understand this kid and understand what we can do at home, at school, anywhere else to kind of make, to kind of speak the kids' language a little bit more and help understand them a little bit better. So we'll get all that information in the first appointment. Some of the other things that I might ask you guys about is, what are the kids' special interests, or what are their sensory preferences? Because I like to have any of that stuff available so that the kids are comfortable when they first come in for testing, so that they have a way to kind of build rapport early on. And then that kind of brings us into the next slide with the direct testing sessions. So after we do that intake and we kind of help formulate those questions, get that background information, we would meet one-on-one, typically one-on-one with the kids. And that would be either with me or with our psychometrician, Paige. Paige is a doctoral student finishing up her PsyD in neuropsych as well. And these appointments are a little bit longer, so they're typically about 2 to 3 hours each. And we either do 1 or 2 appointments depending on the age of the kid. And really that kind of depends on the test that we'll be giving. You know, some tests are a little bit shorter, longer, and kind of like the behavior of the kid, how much they can regulate and focus. So sometimes, especially with younger kids, we'll have shorter appointments, or we'll only do kind of 1 appointment, that sort of thing. And like I said, typically they're kind of one-on-one appointments. The parents will kind of bring them in, help them get comfortable, help them build rapport for that kind of initial bit of testing. And then parents will kind of step out a little bit once the kid gets comfortable and we kind of get into a groove with things. With some of our younger kids, so I'd say 4 or 5 or under, then sometimes the parents will stay for a little bit longer. They'll participate in some of the testing, playing some of the games, doing some different activities with the kids. Because one, you guys as parents, you know your kids better, and you know kind of how they communicate and how they interact and how they feel comfortable. And so that helps us to understand, you know, how are they doing with somebody that's more familiar with them. And during those appointments, I like to kind of tell kids, like, we're going to do some brain games, we're going to do some puzzles, some word games, things like that, to kind of build that engagement. A lot of kids like to do puzzles, they like to do blocks and stuff like that. So that's kind of what we're doing. I'm asking them questions about things that they like, things that are hard for them. Well, we're doing these kind of brain games that look at their attention span, their memory, their social engagement, their problem solving, their vocabulary, to address all of those areas that we talked about in that first session. You know, for these kids, we try to make it playful and we try to make it light, but we're gathering information to help, you know, understand their anxiety, their sensory processing, their reading and language skills, whatever kind of those concerns are. That's how we're targeting the testing. I'm going to the next one. So after we do all those fun little brain games with the kids, and I have certainly sent parents and caregivers home with a bunch of forms to fill out. I've talked to the team, I've tried to talk to teachers, whoever else might be involved in the kid's life and the kid's development. I'll meet with the parents typically 3 to 4 weeks after we do the testing. And I've scored everything, got to consult with everybody, written up a very nice long report, and we'll review the results and we'll kind of go through, like, here are the child's strengths and here are their struggles. And here's how we can utilize their strengths to make things a little bit easier for them. And here's the interventions that we have to help support them through the struggles that they're experiencing. We'll discuss diagnosis. We'll discuss what services, what interventions can help them clinically, and also what accommodations or recommendations might be able to be put in place at school, at home, anything else that we can, you know, use to help support this kid to show their potential and to continue to grow. I always tried my best to give parents some supports, whether it's books, podcasts, websites, and visuals that they can use at home to, like I said, keep going back to those questions that we developed in the beginning to help them support the kid, help them understand better, and also to help the child understand themselves. As kids get older, they want to know, why is this hard for me? What can I do? I want things to be easier. So when it's, as kids get older, we want to bring them into the process and give the feedback to them and give them resources and give them supports to grow themselves and to recognize and show their potential. So, and that's pretty much the process. I do, especially with our kiddos at Eyas, I like to stay on, kind of consult with the teams wherever's possible, chat with them for a little bit. Those are always my favorite conversations, Kelly.
We love them as well. If anyone has any questions, you can either put it in the chat or feel free to unmute yourself for Dr. Shay.
Hi, this is Carmela Davis, and I do have a question.
Yeah.
And I came on a little bit late, so you may have already answered this. So if so, I do apologize. How often do you think do the children or should a child be assessed or reevaluated? Let's say they've already been assessed, they have a diagnosis, but just looking at gains and progress, and they're in a school such as Bluebird, but just throughout their journey, how often should they come to someone like you or be reassessed?
I think that's a really good question. And it always kind of depends on, what we're looking at and our goal for that reassessment. There are certain kind of requirements that we have. For example, qualifying for certain services like ABA, we have to do that full reassessment every 3 years or so. For IEPs, I believe it's every 3 years as well. I would say, as kids are making progress, I would never recommend testing more than once a year, just because the way that the gains that we're looking at, we want to kind of see how they grow and how they stabilize in making those gains. But I say anywhere between probably every 1 year and every 3 years. And I think that once kids start to feel comfortable and stable, and they've kind of, hit those developmental milestones, they're feeling strong and they're showing their potential. And kind of as parents, you're like, my kid is doing great. They're doing what they need to do. They're happy. We feel like they're doing their best right now. I'd say after that, maybe testing once every 5 years or so. But after a point when they've kind of like reached that level of like, this is me and this is who I am, I'd say we don't need to continue testing, just to kind of say, yep, this kid is still who they are and they're still where they were at 5 years ago in terms of showing their potential and their development. Does that make sense?
Yes, it does. So it seems like it would probably be more frequent for like the littles. I call them the littles, like the younger they are as they're developing and kind of coming to their own, and you're really trying to figure out, where they stand, what are some of their strengths and weaknesses. It would be most convenient on that like annual basis when they're at the younger age, and then as they grow and you kind of figure them out more and understand them more, it may could go on to like every 2 to 3 years, or like you said, ultimately every 5 years or so.
Yeah, I would say especially for the younger kids, because we see kind of such, staggered growth in different areas. They'll make leaps 1 year and then they'll kind of like balance out for a little while and then big leaps again. When they're younger, definitely we probably tend to do those assessments and do that tracking a little bit more often. Yeah. And I know like at Bluebird and at Eyas, they do their annual evaluations. And one of the things that might be kind of just a good trigger for, hey, should we do a full assessment again, is there a big change in this kind of annual evaluation? Are we seeing kind of a big drastic change, or are we kind of feeling like they're plateauing? Is there anything else that we can do? That might be an idea to trigger like, hey, let's dig into this a little bit further.
So will the assessment that you or your team conduct, will it be vastly different, or I was like, how does it differ from, if they're going through like the full ABA, if they're at Bluebird and they're having their annual assessments and things, what would be some of the key differences between the assessments that they would naturally have as a student at Bluebird compared to coming, being assessed by your team?
So the testing that we do kind of in terms of neuropsych is we kind of take some of those big broadband assessments that they do at Bluebird, and we try to break them down into their elements so that we get more of that kind of nuanced information. So for example, at Bluebird, one of the things that they include in their evaluation is called like the DAISY. It's a big developmental kind of inventory. And you might see it, it says, to look at cognition and communication, motor skills. When kids get referred to neuropsych, we want to break that down. Okay. So what is cognition? All right, it's their problem solving skills, their attention skills, their, nonverbal kind of, their nonverbal reasoning. And so we can break that down a little bit more. So especially, for example, with our kids that are still building those verbal skills and building that communication, we're able to break down, all right, what is their cognitive ability when we control for the language, when we give them just all nonverbal stuff to do? How do they do? How do they focus? And how do they solve problems? I know that Kelly and I use some of the same assessments for the communicate for the language. So some of those are pretty similar. We do in neuropsych, we spend a lot of time looking at their attention and their focusing ability and their memory, because we know that looking at our kids, there are those kids that just do great when they can focus, but it can take a long time to get them to attend. So we want to say, all right, how long is their attention span and how much can they focus? And then what do we need to really key in their attention and key in their regulation? So that's those are the more kind of specific things that we're looking at in the neuropsych testing.
Thank you.
And to kind of go off what Shay was talking about in terms of having some of the similar testing, especially with speech and neuropsych, is that she's able to really dive in and look at that attention piece of it, look at that cognition piece of it, because she's doing so many different types of assessments, as opposed to when you are just getting an individual speech assessment, we're looking at more of, okay, what are the language difficulties? Yes, we touch on cognition and some of that executive functioning, but it's not really where we're diving deep into how to support the child. So it's something that while we're doing something pretty similar, we're getting very different results, and we're able to then go back and collaborate and really figure out how to best support the child and meet their needs.
Yeah, I would say one of the nice things about kind of doing neuropsych and some of the feedback that I've gotten is to be able to kind of see everything so integrated together. To be able to kind of see like, all right, let's look at how much is executive functioning impacting their language and how much is sensory processing impacting their reading or their math skills. And in a way that I think it's hard to kind of, with all of those separate meetings that you go to, it's hard to kind of integrate together. So.
And I think it's part of what makes Eyas so special. It's our interdisciplinary approach, which we'll talk about in a few slides. If anyone has any further questions for Shay, let's see, I just have one pop up in the chat. Okay, what's your wait time and evaluations for diagnoses?
So I am not certain what our wait list looks like right now. I know that it's not too terribly long. I want to say probably a couple of weeks for the wait list. The time from like intake to feedback session is generally about 4 weeks.
Is a referral from the pediatrician needed?
I think that will depend on your insurance. Is that right, Kelly? Yeah.
That should depend on your insurance, and that's something, if you're interested in it, reaching out to our admin team, whether or not calling the front desk or sending an email to our scheduling team, they'll be able to provide you with those answers of what information is needed, and then starting to set up that process, or if there is additional documentation, they can help support through that.
Yeah. I saw the comment that it is 12 to 14 months elsewhere. Yeah. The wait list, I think, especially at a lot of hospitals, is crazy long. We're really lucky right now to not have a super long wait list. And I think the way that we've designed the neuropsych program was very intentional to make sure that we have that quick turnaround. Because I've seen people wait months just to get a report. And at that point, it's like, well, is this even the same kid? Especially with those little ones, those 3 and 4 and 5-year-olds, because they grow so much. So that's why we want to make sure that we get that turned around really fast, so you guys have the information to advocate and to get those accommodations in place and all of that other stuff.
And also too, in speaking about that length of time and making sure that it's shorter, I mean, we've seen our kids be able to receive different services or more intensive services just from receiving their most accurate diagnosis. And so that is another reason why it's that much more beneficial.
You're welcome. I think we can, if anybody else has any questions, we can answer them, or if you want to kind of go on to touch on the next part.
Yep, I was just going to say I'll go on because it kind of all intertwines together. If you guys do have any other questions, feel free to put them in the chat, or just you can either unmute your video, so then that way that'll alert us, or you can unmute yourself and just ask as well. And so what we'll go over next is just talking about the other therapies that we provide. Shay was gracious to talk to us all about the neuropsych evaluations, and we talked a little bit about the different types of therapies that we offer at Eyas Landing in the very beginning, but now we'll go into them in a little bit more depth. So we do have occupational therapy, and so the things that they are working on are either handwriting, they're working on executive functioning skills, as well as sensory processing, social skills, play skills, self-help skills, and vocational skills. So as a speech therapist, I know that when I'm recommending occupational therapy, a lot of the feedback that I'll get from families is either, well, they don't need to be working on handwriting right now because they're too young, or their handwriting, a lot of it just really goes around handwriting. And one thing that I feel like I always then prompt back at is a child's occupation is play. And so yes, handwriting and the legibility, the speed that they are writing, and being able to, put their written language down on paper and to write on paper is very important. But it's also really important that they are able to carry out what our child's job is, and that is that they're supposed to be able to play. That's their occupation at this age. And so being able to work on those executive functioning skills of organizing materials within the environment, following multi-step sequences, as well as, again, that attention to task. Occupational therapists are helping with that. They're helping with building that sensory processing system so they're able to process the information that's around them. They're also able to help your child with the ability to remain calm or to be more alert within different stages and really make sure that they are working on that modulation instead of something that would be more of a dysregulation. Then our speech language pathologists, so we are focusing on language difficulties, whether or not it be receptive language, so what we're understanding, or expressive language, so the things that we're able to express. We are focusing on the development of vocabulary, as well as grammar and different concepts within our language. Voice difficulties, so if your speech or your pitch is too high, if it's too low, if it's monotone, so it's not having any kind of intonation, if it's too loud or soft, hoarse, harsh, nasal, or breathy, really analyzing those vocal qualities and being able to provide therapy and strategies to support that vocal quality and vocal health to improve. We do work on fluency as well as articulation. And so articulation is really defined as saying one sound for another, or also any kind of misarticulations. It's something that is not appropriate for the child's age and is really impacting the way that they're able to be understood and their intelligibility. Looking at maybe omitting some sounds or distorting a sound. And this develops as your child's developing. So if you have any questions about articulation, we have some blogs written on our website and can always reach out in regards to that. For our speech language pathologists, we're also working on feeding and swallowing. And so we are working on that mealtime, making sure that all the structures and everything are in place and working to the best of their abilities to be able to participate within that meal and within a variety of different types of foods. And then also, are we tolerating the different types of foods as well? Then we have our physical therapists. So they are working on navigating in a variety of different environments. If anyone has been to our clinic at Eyas, we have staircases, we have big gyms, we have everything that you could possibly need in order to work on that navigating piece of it. And like we had talked about at the beginning, we're in a variety of different environments. So making sure that your child is able to navigate safely through all of those environments is very crucial. Again, working on stairs and those different surfaces, whether you're going in between mats or hard surfaces or carpets or crash pads. They are also working on walking and running as well as jumping, and then ball skills for peer activities such as either baseball or soccer. And we saw a lot of that. They were really helping us with our bike riding camp this past summer, as well as our sports camp. Then we have social work. So our social work department, they're working on supporting children to identify and understand their emotions. They're tackling barriers to success that are related to either their emotional or their social experiences. So really helping our kids be able to identify those pieces and feel comfortable and confident in expressing it, and then how to problem solve and kind of what to do in different scenarios. They're also supporting our families in accessing resources for their child and really being the family's cheerleader. We also have our ABA team. So we have our applied behavior analysis. We have a group of wonderful BCBAs, which are our board certified behavior analysts, and our registered behavior technicians, as well as our behavior therapists. And so they're working on academic and cognitive skills for school readiness, social skills, play skills, self-help skills, coloring, cutting, and writing skills, toilet training, group skills, community skills, and vocational and household skills. Our ABA team does a lot. And the best thing about what they do, especially at Eyas, is they're working on these skills within a functional environment. We touched a little bit before about the interdisciplinary approach. We'll talk about it a little bit later. But our ABA team is really making sure that they're hounding in and supporting our kids in developing all of the skills necessary for them to be participating in all different types of activities. One of our newest supports that we have our therapeutic tutoring and educational supports. So we are providing progress monitoring and response to intervention, which includes either on-site progress with monitoring assessment, instruction, consultation hours, and meetings. And so this is occurring with school staff, and so consulting on IEPs that have already been developed. We also are doing education consultations with teachers, as well as education consultation with response to intervention interventionists. So all of this is happening within the school setting and being able to provide that consultation support. Any questions regarding those different services? Okay, if you do, feel free to interrupt me or put it in the chat. I'm going to keep going as this kind of ties it all together. So these are foundational models that are used at Eyas. You have heard Shay and I speak about our interdisciplinary care. You've heard us speak about the different therapy services that we provide, what's happening during team meetings. And so these are the things of what makes Eyas so special, and really what each of our therapists, it does not matter the discipline, are implementing within their therapy sessions. So we'll talk a little bit about our relationship-based model, as well as our interdisciplinary care, intensive therapeutic programming, and floor time. And so our relationship-based model, this is our intentional relationship model. This is originally an occupational therapy model. We have adapted it and use it across all of our disciplines, as we've really valued it to be really something that's very important and makes our therapy sessions quite unique. It's defined as the way a therapist uses their sense of self to build rapport and enhance the therapeutic outcomes with the client through the use of these 6 modes. So the modes are collaborating, empathizing, advocating, instructing, problem solving, and encouraging. And so what you're doing is you are observing the child within your session, and you're determining, okay, what mode is going to be beneficial. They are coming in, they're crying. I am not going to go into an instructing mode and just start providing them with all of this instruction. I might start to empathize. I'm going to see, okay, what is going to be something that's beneficial? Should we go and start in the swing? Should we go and maybe start within a sensory room and really continue to hone in on that relationship? We can change our therapeutic style and our therapeutic use of self to be able to be more successful within our therapy sessions. Another thing that we're using within all of our therapy sessions, and we've talked about this, is our interdisciplinary care. And so you see the circle to the right where you have all of our disciplines. And what's really unique about this is we are all collaborating and combining approaches from all of these different disciplines to make sure that we are creating a holistic approach towards our child's therapeutic outcomes. So what does this mean, right? It sounds fancy and nice, but what does it all mean? What it means is that our speech therapists are collaborating with our physical therapists. And so maybe our child might be working on walking up the stairs. And for the speech therapist, we are working on them making different animal noises. And so this is an example of what I've done during therapy is I've put animals on a stair and we are walking up to each animal. We're making the animal noise and we might be throwing it down into a bucket or we might be throwing it up. Something that is going to be really exciting. I am targeting my goal in terms of working on the animal noise and working on imitation of that, but I'm also helping increase the number of times that they're walking up the stairs. So I'm indirectly working on that PT goal as well. We are using these different approaches to make sure that our kids are really developing as a whole and having a strong base and a strong foundation and not just creating these different types of scattered skills. That is one very specific example of speech and PT working together, but it really works everything as a whole and it ties it all together in terms of having our kids reach their fullest potential. And our specialty. If you're not familiar with Eyas, then this might be a bit of a shock. If you are, you've heard this before. We definitely believe in the use of intensive and interdisciplinary therapeutic programming. So we have our interdisciplinary, right, that we just spoke about, where all of the disciplines are working together and collaborating. Well, we also believe in providing this in an intensive basis. What that means is that our kids are receiving multiple therapies across the course of the week with the idea that we are really front loading those services so then that way later on they do not have to have as many services or maybe don't have to have it as long. We know that the neuroplasticity of the brain really is very flexible and moldable within those early years, and so honing in on that, trying to provide them with the best support so then that way they can develop those skills that are unique to them and be able to build on top of that. So what we're doing at Red Merlin, what we're doing at Eyas is we have two different programs. So we have our Merlin program, which is our newest program. It's an individualized intensive therapeutic program for children who have aged out of Bluebird Day, which is our sister company. And the team recommends that they continue on with an intensive service before transitioning to a more traditional school setting. We have individualized schedules for our clients that are based off of our clients' needs. They are based off of the track and what is determined to be the sole focus. We have a motor track as well as a communication track. And then there is that heavy emphasis on ABA. We talked about at the beginning how our behavior therapists kind of do it all, right? And so here's where that interdisciplinary practice really works, is that all of the disciplines are working with our ABA team to, yes, when you're working on cutting, this is how you'll be able to best support them holding the scissors and holding the paper. When you're working on naming or labeling colors and naming different items, here's the best way of how to support them from a speech approach. So then that way they're developing more of that language and they're not necessarily just waiting for your prompt or they're just waiting for the specific cue. They're really learning what these different items are. We are working on also within our Merlin program, which is very exciting, our ISB approval to become a certified school. We have seen such a need for this type of program with the Merlin program over the past few years and have grown a tremendous amount. And so this is something that we think is really beneficial and going to help support our community. As well as our Merlin program, we have our individualized intensive services. So these are children that are receiving services more than once a week in multiple disciplines. It is recommended for children with more significant needs. So they might be receiving services within the school or attending a traditional school setting. And then they're coming for individualized intensive service following that school setting, or they might just be receiving individual intensive services outside of the Merlin program during school hours. Again, the goal is to front load these services so that they can be faded as the child makes progress, or they're able to be transitioned into either a Merlin program or a more traditional school setting.
I think one thing just to
Yeah.
to point out and to make note of is like, although we're doing a lot of intensive therapies, they're not sitting at a table all day. These kids are running around. They're in the big gym. They're playing. Like, the team makes this so much fun for them. So when we think about like, oh, this is intensive therapy, the kids are having a blast. They really, I can hear them from my office and they're fine.
Not just the kids and the therapists, right? And it kind of goes into, I just saw something pop up in the chat though too.
Yes.
Oh, I see Wheaton at the very bottom. Is that program from children aging out of Bluebird coming to Wheaton? They are. My kid is very tired every single day, and his therapists are. I'll tell you that one. I was the one climbing up the stairs with the kid as well, right? So I am not sure about in regards for this program coming out to Wheaton. I know that it was really exciting. The Wheaton location is gorgeous. We just got to see it last month. I don't know. Never say never.
It would be great. I know that there's a need out there.
There is.
So.
And that's where we have seen such a growth. I think that that's something that, will definitely happen. I'm not sure exactly when it will. To give everybody a bit of a timeline is that when I first started with Eyas Landing 7 years ago, Bluebird was a part of Eyas Landing. And since then, Bluebird has become its own company, as well as now had 3 separate locations. And so and Merlin has also grown. So I do see it going out into the suburbs. I don't know the timeline in terms of when that'll happen. Talk to Jen King. There's one more question. I'm trying. Merlin is a remarkable program. Would be great to have it available at all Eyas locations. Yes, it would be. I just see it continue. I see it continue to grow and to really go across multiple locations. This is something that's really going to take off. Yeah. And as Shay was talking about, and kind of leads us into our next slide, is that she's completely right. We are not sitting at a table. It's one of the things that I say to any new therapist who's coming into Eyas or who is starting with Eyas. We are following the child's lead. And so we are not only using the IRM approach, and we're not only using our interdisciplinary approach, but we're using the DIR floor time model. And what that means is that we are following the child and what they're interested in. We are getting away from the table. We are climbing on top of the trampoline. We are climbing under the trampoline if no one else is in the room and it's safe. But we are looking to see what are they interested in. A lot of the times you'll see within therapy that, we are trying to pull the kids out of their interests and into our own. We have our lesson plans, or we have our books that we might be very excited about, and we're like, you're going to be excited about this too. No, I don't think so. And so instead of us telling, no, come join me, we are going to join them. And to see a child start to realize like, oh, you're interested in what I'm interested in. You're looking at the things that I'm looking at. They're going to become that much more motivated to engage and to really participate in what your therapy outcomes are. So our floor time model is a child-centered practice that utilizes a framework for understanding a child through their individual differences, meaning every child is the same. They're going to have different interests. We are focusing on utilizing the therapist relationship with a child to promote participation, volition, and skill development. And so we are following their lead. We are tiring them out. They are tiring us out, and we are all learning at the end of the day. And it's a whole lot of fun. So yes, it sounds like a lot of therapy. However, remember, child's occupation is play and fun. And so that is what we are helping them do. If you want to learn more, you are more than welcome to call us. So that is our phone number there. I will leave this slide up, as well as email us for any more information. You can visit us online as well and learn more about Shay, learn more about myself, as well as more about the clinic. There are blogs that are available on there, as well as some video resources. But that's the end of our presentation. If anyone has any questions, you're more than welcome to either put it in the chat, or you can also unmute yourself and ask us.
Hey, Kelly, it's Beth.
Hey, Beth.
Hi. This was really, really helpful. Thank you so much. I was wondering if it would be okay if I post the recording of this presentation on our parent support group Facebook page. We have a lot of, I was wanting to join because I haven't done a neuropsych eval or anything in so long, and I don't know what the process is at Eyas. And so we have a lot of parents who have young kids who come to the group asking about this, and I wanted to get some more information. And I think that this is like exactly what a lot of them need.
Oh, good.
Just wanted to see if that would be okay if I post it.
Yeah,
Okay.
no, that's
I just
fine.
didn't want to put it
have-
on the Facebook world without getting your okay.
As soon as I have the recording, I will send you an email of that.
Thanks so much.
You're very welcome. I know it's late on a Wednesday. I feel like whenever I do trainings or things like that with parents on Wednesdays or even therapists, again, we're tired. It's been long days of chasing after our kids and everything else that you guys are doing. So I know that Shay, I'm going to speak for Shay and myself, we very much appreciate you coming on and asking your questions and listening to us talk about Eyas Landing. I feel like it's something to talk about for eons.
We definitely appreciate your time. Oh, good.
We have to get the look. We have to get the Merlin program in Wheaton.
I will let them know that you said that.
We will push it. We will push it. We love the Merlin program. So.
We do love the Merlin program. It is something that has been so beneficial and, you know, just so great to be able to see our kids, not only to continue with them, because some of us have seen them for quite some time, but just to see the gains that they're making. And it's so important and just very incredible.
Yeah. Doing the neuropsych testing, I get to see the kiddos from every different location. And I think that's one of the biggest questions I get. It's like, okay, after Bluebird though, then what do I do? So yeah, we need one out in Wheaton.
We have a lot of Wheaton people on here. Love it. Okay, well, if you guys do have any questions, feel free. You're more than welcome to reach out here. You're welcome to also email me or email Shay as well. Our email should be on the website. And yeah, it was so nice having you all.
Thank you guys so much for your time. And yeah, reach out, feel free.
Bye, everyone.